Okay, so we're going to go over the axial skeleton, and during our Zoom time together, we will go through the muscle list um, that I have posted and go through each individual muscle, talking about the actions that each of those muscles does at the particular area or joint. But we're going to go through chapter 10, and I'll point out some things that can be helpful, and we'll go from there. So like the axial skeleton and appendicular skeleton, the axial musculature is really the muscles that are arising on the axial skeleton. And so they're going to include muscles that are on the face, on the head, neck, your spine, and anything kind of related to that. So your ribs, and pelvic floor muscles. So the muscles can be based into 4 groups from either their location or their function. So muscles of the head or neck, muscles of the vertebral column, again, ribs, abdominal area, and pelvic floor. Muscles of head and neck are either going to be muscles of facial expression, so muscles that help you move your face, muscles that help move your eyes. So you have external eye muscles that are attached to the sclera, the outside of your eye, and they can move your eye different directions. You also have intrinsic autonomic muscles that control the diameter of the pupil, and we're not going to talk about those. That's part of the autonomic nervous system. You have muscles that help you chew. That's muscles of mastication, as well as your tongue that helps you move the food around, and then muscles of the pharynx that help you swallow. So muscles of facial expression, they're either surrounding your eyes, so the orbicularis oris, buccinator are your cheek muscles. So if I were to say suck in your cheeks to make a fish face, those would be your buccinators. Temporoparietalis and temporalis, those are on the sides. And if you clench your jaw, the temporalis is one of those muscles of mastication. You have the muscle that goes from your frontal bone to the occipital bone. That's the occipitofrontalis. There's an epicranial aponeurosis that connects the frontalis muscle to the occipitalis muscle. And then there's the platysma. The platysma is the front of your neck. It's this very, very thin muscle layer in the anterior of your neck. And if you clench your jaw and kind of jet your jaw forward, you will see this thin kind of lizardy-like wing out of this thin muscle, and that's your platysma. So the platysma is kind of, they're showing it here. This right here is your platysma. It's very, very thin. Other muscles of facial expressions. So the ones around your eye, the orbicularis oculi is that muscle that you can close your eyes. It's a circular muscle, and you can close your eyes, squeeze your eyes shut tight. That's your orbicularis oculi. You also have a muscle on the top of your eyelid, and that is your levator palpebrae superioris. And I don't see it listed here, but I'm sure on some picture it does have this. You also have your corrugator supercilii, these ones right here that allow you to kind of a little bit of your frowning muscles. And then you also have your nasalis and your procerus. So let's see if they don't really show the, oh yeah, they do show the procerus right here. So these are the ones that a lot of people in this area get Botox, so they're not having frownies. The occipitofrontalis, here's the frontalis. And here's the epicranial aponeurosis, and in the back would be the occipitalis. Okay, so moving down, you have the muscles that help you smile. So you have your zygomaticus major and your zygomaticus minor on both sides. And these are your true smile muscles. So these right here are your true smile. Around your mouth, you have the orbicularis oris. This is what helps you close your mouth in a circular fashion. These are circular muscles. And then directly out to the side is the risorius, is this muscle right here. So that's the risorius. It pulls your mouth straight out to the side. So the angles of your mouth, the risorius pulls it straight out this way, kind of gives you a wry smile. The buccinator is this muscle right here. And the masseter is on top. So the buccinator kind of moves your cheeks in and then puffs them out. The masseter is a muscle of mastication, and that's that big side jaw muscle there. You have some muscles that pull your lips up here, so it pulls it up like that. That would be your levator labii superioris, and then you also have ones that pull your muscles down or depresses it. So depressor labii inferioris and depressor anguli oris. So they kind of pull, they can make you get a pouty lip. So these are the main muscles of your face. And again, your temporalis is under the temporoparietalis, and this is a muscle of mastication as well. So those are muscles that move your face. Extraocular eye muscles, these are the intrinsic muscles. It's kind of a weird picture that came out, but basically you have muscles that move your eye. So if this is your right eye, that would be a lateral. That would make your eye move medial. That would make your eye look down and look up. So these are the rectus muscles. So the lateral rectus moves your eye laterally. The medial rectus moves your eye medially. The superior makes it look up, and inferior makes it rotate or look down. Now you have two obliques. Oblique means at an angle. And so this one has this trochlear sling right there. So it pulls up and then pulls down, and it's going to rotate your eye down, or it's going to pull and rotate your eye up. So when you look cross-eyed or look at your nose cross-eyed and you look up, that's your inferior oblique. If you're looking down at your nose cross-eyed, that's your superior oblique. So they just kind of rotate your eyes. And this kind of shows you. Again, muscles of mastication, the main ones, masseter and temporalis. You have pterygoid muscles from the pterygoid processes down to your mandible, and they help move your jaw side to side and open and close your jaw. And so they're called muscles of mastication for chewing. Muscles of the tongue, we don't really talk about. If you're in dental hygiene or you do your head and neck anatomy, then you would go through the genoglossus, hyoglossus, palatal-glossus, and styloglossus. It's really just location, but I'm not really going over those. Okay, muscles of the back or the vertebral column. So there's three different layers. You have the superficial layer on top. They generally move your neck. You have the intermediate layer that's kind of between the superficial and a little bit deeper, and these are going to move your vertebral column. And then you have the really deep layer that interconnect all of the vertebrae. So we're going to look at those. The superficial layer of back muscles here are going to be the splenius capitis and splenius cervicis. So when we're looking at the splenius cervicis and the splenius capitis, and it's this here, and they're on both sides, you're just not seeing them on both sides, right? And the splenius cervicis. So they're going to move your head, and they're going to pull your skull back. So in that almost hyperextension, pull your head back. Or if you're looking down at your shoes, they pull you back into anatomical position to look straight up again. The intermediate layer is called collectively your erector spinaea. So your erector spinaea is a group. And so what this shows you really is that all of these muscles are on this side and on this side. They just don't have them on the left side, but they're on the left and the right. This muscle down here is your quadratus lumborum. And here it's a quad in your lumbar area. So the erector spinae are on top of that, right? These are your erector spinae grouping. Now the erector spinae is going to be named basically for whether it's attached to your head, which would be capitis, whether it's in the cervical area, which would be cervicis, whether it's in the thoracic area, attached to a rib, that would be thoracis, and whether it's in the lumbar area, okay? And then it also goes spinalis, longissimus, and iliocostalis. So it goes basically, the ones that are closest to the midline are going to be the spinalis. So this would be spinalis, the ones that are near the spine or the spinous process. And then the next one over would be iliocostalis. And then the most lateral here is longissimus. So it, they just kind of go in order. In functional anatomy, I'm sure that you will learn all these. For this class, my expectations are that you know collectively the erector spinae as a group, and that they extend the spine or back or trunk. Also, the QL, quadratus. Oops, morum. And that also extends your lower back. So those are the two, quadratus lumborum and the erectus spinae. The deepest layers are where you start getting into the ones that are connecting each vertebra to one another. And so you have the semispinalis group and the multifidus group. You also have the intertransversi and the interspinalis. I'm not going to test you on these deeper ones, but I do want you to see how many spinal muscles you have in these little tiny ones that are really going between the transverse processes and the spinous process. A lot of little ones. Again, quadratus lumborum. In addition to extend back, also flexes laterally. So lateral flexion. So this right here kind of can flex, pull your spine that way. So that's the quadratus lumborum. You have the spinal flexors that are called your scalenes. And so these scalenes also can laterally flex your head or neck and flex it forward. Okay, so goes through scalenes. I don't ask a lot of questions on scalenes. Again, you have the erector spinae group and the quadratus lumborum. Those are the two important extenders. On the front or anterior, you're going to have the abdominal muscles that we're going to focus on. The intercostal muscles are for breathing. And the external intercostals elevates the rib for inspiration of air. And internal intercostals depress the ribs for expiration of air when breathing. And then we get into these abdominal muscles. So I don't really go through the serratus posterior, but let's talk about the abdominal. So the ones that are really important here to understand are going to be the rectus abdominis the internal obliques, external obliques, and then we'll get into the transverse abdominis. So let's talk about those. Rectus is going to mean straight, right? So the rectus abdominis is straight on the abdomen here. So that's the rectus abdominis. It's the washboard. Rectus abdominis flexes trunk, right? And compresses abdomen. All of the abdominal muscles are going to compress the abdominal area. But the rectus abdominis, these muscle fibers run straight up and down, and so they will bring you straight into flexion. If you want to flex and rotate, that is where the obliques come in. So these are the external obliques, and they're going to flex and rotate trunk. The internal obliques as well kind of are going to go up somewhat in this position, and they are going to flex and rotate. The transverse abdominis is compression, and so the transverse abdominis is going to be in the transverse plane. I'm trying to find a picture of this, but I don't see one. The transverse abdominis kind of goes around in a corset around your body. So if I were to say suck in your abdomen, right? You want to pull in your abdomen and make your waist smaller. That would be transverse abdominis. And that would be pulling your kind of corset in. And so the deepest layer is going to be the transverse abdominis. So right here, you're going to have transverse abdominis. And then the next layer is going to be the internal obliques. Right, so you're going to have the internal obliques here. And then the next layer out is going to be external obliques. And then you have the rectus abdominis here in the front. And by the way, again, erector spinae. And then you have quadratus lumborum. So this goes through, I want you to focus in on the abdominals, also the diaphragm contracts and expands for breathing. It's your primary breathing muscle, along with the external and internal intercostals. And so again, diaphragm, when it contracts, it presses flat and that brings air in, and when it relaxes, it goes back into a dome shape and pushes air out. Pelvic floor muscles, you have your urogenital triangle and your anal triangle and your pelvic diaphragm. So these basically form the pelvic floor muscles, and they're in males and females, but they support all of the intestines and bladder, and for women, the uterus. And so these are the muscles that kind of hold everything up, along with ligaments. And that's it for chapter 10. When we go through the muscle list during class section, we'll talk about each muscle individually, and I will have a little model that I can show you, and we'll discuss it then.